This is an overview of the Presbytery Shared Pool Wraparound Benefit Program. It's brought to you by Mission Communication and Pensions and Benefits Committee. In 2012, the Presbytery conducted a survey designed to measure your satisfaction with the Wraparound Benefit Program. The survey showed that a good one-third of those eligible to enroll are not enrolled, and for a variety of good reasons. You are eligible to enroll if you are a member of the Presbyterian Church Board of Pensions Major Medical Health Plan. For those who are enrolled, there are benefits. It's a gap insurance program that offsets medical and pharmaceutical expenses. It shows the communal nature of our church. If you have an expensive disease like cancer, it extraordinarily helps with medical expenses. And it contributes positively to the living wage of our pastors and our support staff in our churches. Surveys showed that communication, education, and interpretation about the wraparound policy and program are sorely needed. Here are some reasons cited for not enrolling. Many of the churches said they cannot afford the annual dues of 1.75% of the salaries of their enrolling pastors and support staff. Other people said they simply did not understand the policy and the procedures of the program. You can download it on powpres.org. Read it, study it, ask questions. And many people said they didn't know the medical wrap program existed. It's a well-kept secret, and it's a treasure. We're one of just a small handful of wrap programs left in the denomination. Many people said they had trouble filing claims. They had difficulty obtaining their insurance information. They had difficulty completing the claim forms. They did not receive enough benefit after completing the claim forms. They didn't know where to access claim forms, and they didn't know enough about the program to even get started. Help is on the way. We're going to go through each of these claim difficulties one by one and try to give an overview so you will at least know where to go for answers. Obtaining your insurance information is protected by privacy laws. No one can obtain it but you. Go to pensions.org and create a personal account at Board Connections. Go to express-scripts.com. Call their phone numbers. Find out about your services, your pharmaceuticals. Find out if your drugs are name brand or generic. There are lists on sites. Do you have difficulty filling out the claims? Filling out insurance information is difficult because you're transferring information from one claim to another. We will help you recognize what the claims look like. This is an Express Scripts invoice. It shows the number, the invoice number, who it's going to, and your pharmaceuticals. It tells how much the drugs cost. You transfer that information into this simple form, this reimbursement wraparound prescription drug claim form found on powpres.org. Your name, the date, the drug, what type of drug it is, and the total cost, and how much the plan paid. This is an explanation of benefits in EOB by the Board of Pensions. It tells allowable coverage by the plan, how much the Board of Pensions paid, and if you subtract that, some of that cost is covered by the wraparound benefit. It goes directly into your pocket. You put the patient's name, the date of the service, the amount allowed, the amount the Board of Pension paid, and somewhere between those two amounts is your wrap benefit. All of your information is protected by privacy laws in the Presbytery office, in the Board of Pensions office. The wraparound plan covers a family deductible, one amount per year. In 2013, it covers for a family a copay and deductible up to $500, and for an individual a copay and deductible up to $300 for this 1 year only. The plan covers family and individual combined out-of-pocket expenses to the maximum in-network and out-of-network cost. It covers copays for generic brand names and formulary drugs up to a maximum of $2,500 per individual or member and family. All of this information, all of the policy information and explanation and forms are right on our palpres.org website. Scroll down to the left, it's under Pensions and Benefits. Here's a summary. The plan does not cover non-formulary drugs, drugs not covered under Express Scripts agreements, and surcharges applied to non-home delivery service maintenance drugs like your blood pressure medication and your cholesterol medication. The plan doesn't cover dental. It just doesn't. It doesn't cover prosthetic devices. It doesn't cover any charges or medical expenses not covered by the Board of Pensions. It doesn't cover any charges or limitations put on by the Board of Pensions. And still, there's a benefit. So that's what our Major Medical Shared Pool Wraparound Program is all about. If you enroll, if you jump right in, you will see a benefit. But you have to ask questions, you have to file claims, you have to interpret invoices and explanations of benefits. And we are here to help you do it. The staff of the Presbytery is here. Its committee members and the Board of Pensions will all answer questions and sit down with you personally and help you figure it out. It's a plan that's well worth enrolling. Thank you.